Good evening. We've now reached the hour of interruption. The topic as chosen earlier in today for late debate. Therefore, be it resolved that this NDP government commit to completing the 4th year of the Boots on the Street program so that the police agencies across Nova Scotia can have the resources they require to combat a constant threat to public safety. I will now recognize the honourable member for Cumberland South.
Well, thank you, Mr. Speaker, and thank you. It's an honour to stand here tonight in my place and to talk about this issue that's very, very important to me, and I know very important to police officers and communities across Nova Scotia. I'm just going to read the therefore be resolved that this NDP government commit to completing the 4th year of the Boots on the Street program so that police agencies across Nova Scotia can have the resources they require to combat a constant threat to public safety. And I guess, Mr. Speaker, I want to begin by saying that I'm kind of disappointed that the resolution that I put forward was denied by the government. As members of the House would know, being a former police officer myself and the Attorney General being a former police officer, having the resources to do the job, and particularly in the climate today in the policing community, the technology and the ability of criminals to be able to create a lot different atmosphere from policing community to tackle them it's a lot different today than it was decades ago. And I firmly believe. I remember when I excuse me, when I first became the Attorney General, Premier MacDonald at the time he was doing a province tour, and he met with me one night and he said one thing that was very prevalent to him in his travel was the number of our youth involved in drugs and drugs around schools. It wasn't very long after that. In fact, I had from the Honourable Attorney General's own riding, chiefs and the RCMP come into the department and wanted to meet with me, and we met, and they had devised a plan that they felt would help them tackle crime better in Pictou County, and it was going to require some resources. They said the communities there felt there were huge problems there, and but they needed help, and asked if I could find funding to specifically help them. And at the time, I wasn't able to tell them because we had in the works the Boots on the Street program, but certainly I told them that I would do what I could, and they went away, certainly hoping they were going to get some help from the province. So the Premier, in his travels, heard loud and clear from a lot of parents about drugs around schools. We heard from the policing community ourselves that there was a lot of work that needed to be done, that should be done. Municipalities didn't feel they had the resources to tackle it right here in HRM. I had discussions myself with the chief and deputy and the mayor about resources and about the need to put more uniformed, particular bodies on the street and to help fight crime. So, Mr. Speaker, and again, in my previous career, I understood fully where these folks were coming from. It was pretty obvious to me that a lot of departments will amalgamate or they'll change services. And it seems to me, I worked in Moncton, and I know, you go from 25 or 30, and I forget the number now, within the regional area, down to 6 or 8 or 10 on the street at night. You can't expect a third or half of the people, when you have increasing crime rates, to do the same job as a higher number prior to that. So Mr. Speaker, we gave it a lot of thought and did a lot of consultation with the policing community, and went back to the Premier and said, we can do this, but it's going to cost a substantial amount of money to put a program in place, and we can start and put the funding in place right away in the first year, and we can signal the municipal units and the RCMP that we're going to be there to support them. But they had to obviously know this earlier on, so they could prepare for those who are doing the training and get prepared to do the hiring. And I think even the RCMP have a challenge today in regards to attracting the proper number of bodies across this country. I think it's a challenge, like it is for them, like it is for the armed forces and so on. So we tried to signal earlier on that we were going to be there for them, that we would develop a multi-year program, which turned out to be a 4-year program, to put 250 additional police officers on the streets in Nova Scotia. And those positions will be paid for by the Department of Justice through the Government of Nova Scotia. I also want to ensure that, that small units, wherever they were in the province of Nova Scotia, would not be left out of the equation, and made the commitment that at least every community throughout these rounds of allocation of officers, communities would all at least receive one, even smaller ones like I believe Annapolis Royal. So I was pretty proud, Mr. Speaker, and I think probably one of the smartest moves any government has made, I think, and I've seen in a lot of years in regards to tackling a specific issue, which in this case is crime, and offering resources to those who provide it to help them get the job done. Now, I remember some of the officers went to a combined unit down in southwest Nova Scotia. It was a highway patrol unit, and I remember watching over the number of months after that, phenomenal amount of work done by that group in regards to highway safety. The other thing that the Premier had said to me at the time was, in justice and in transportation, that we had a high number of deaths on our highways in Nova Scotia, over 100, I believe, at the time, and he wanted myself and our departments to try to work on reducing that number. So that's a pretty erroneous, I think, mandate to be given to reduce the number of people killed in your highways. I just had a discussion this morning with someone on the phone about keeping headlights on, and they're upset over the fact that they have to have their headlights on in Nova Scotia now. And I said, you know what? If it meant the end of my days as an MLA, if one person's life saved because people have their headlights on now, I'm happy with that, and I can live with that. And and I said we had the support of all parties here to move some of that legislation through. There were no arguments. In fact, there was a lot of help from members opposite here, and so we moved it all through. But back to the issue of the officer. So I truly believe, I said to the Premier at the time, it'll cost, after we have the full implementation of the 250, it'll cost the government of Nova Scotia $25 million a year to keep this program going. And so, Mr. Speaker, now I may have the number wrong here. I'm sure the Attorney General will set me straight, but I think the number is 167. I think is the number that's been met. I think somewhere around there, but I'll wait to see what he says. But then my understanding is that the program, I don't want to say canceled, but my understanding is the program is frozen. 163? 183. Thank you. 183. 183 is the number so far that's been allocated to the RCMP and to municipal units throughout Nova Scotia. And I look in my own area now. Pictou and the Bridgewater area, I think they were the first to actually take the positions and make JFO, you want to call them, or the street crime units, where the RCMP and probably the Attorney General was part of that himself, because that's where he served a lot of his last number of years of career, where they were able to take the municipal units and the RCMP and actually put them together in a street crime unit and tackle those issues head on. In Bridgewater, I was in there and met with them, and I believe they've done the same down there from the earlier on days, and phenomenal results. Results I'm very proud of. I think it's led to reduced crime in neighborhoods. It's given people a good sense of safety in their communities. I think it's really taken on and tackled the issue of drugs in around our schools. So it's a phenomenal program, and one that I'll be proud of, Mr. Chair, Mr. Speaker, for years to come. Now, there were other areas where maybe they weren't able to bring the resources together as quickly as I hoped they would, but I felt it was important to allow them to have the ability to flexibility as well, I guess, and I thought eventually they would come to an agreement that they would have to work together. And Cumberland County, use as an example again, earlier on that didn't work like it did in Pictou, but now my understanding in Cumberland County is those municipal and federal officers, provincial officers, are working together in an integrated street crime unit, and I just watched the paper for the last 3 months. Phenomenal results. Drug charges. There's warrants being executed on a regular basis. There's people being charged that I believe without the additional resources being provided through the department would have escaped being charged and would have gone on to do what they're doing. But I know, Mr. Speaker, I don't have a lot of time. I only have a minute left. I do want to say that I'm really disappointed that this government has decided that the Boots on the Street program will at least, I don't want to say be canceled, but I understood will be put on hold. I think it's a program where, yes, it costs a lot of money, and I'll tell the Attorney General this. I know myself, and I had to go to Cabinet, and I had to fight hard to keep that program going because there's lots of demands. Health and education are big demands. Transportation, of course, is. But I know that it's not easy to get those dollars, not easy to get Cabinet to find dollars, but I think for safety of our communities and for the protection of our children, the future generations that are coming here, and especially around our schools and the great work the police are doing around Nova Scotia. They need the support of the government. They need the additional resources to help them get their job done, and I'd ask the Minister to reconsider this program to be sure it continues in the future. Thank you, Mr. Speaker.
Thank you. I will now recognize the Honourable Minister of Justice.
Thank you, Mr. Speaker. Thank you for the opportunity to rise here today and discuss the government's plan on policing and public safety. I, like the member across, have been as a police officer for over 35 years, and I'm committed to police officers. There's nothing probably more important, and one of the reasons that I'm here today is because of my background and my commitment to that very issue, and I'm in a portfolio where I can actually make an influence and make a difference, and I feel very strongly. And I have worked many years in this justice system, and to improve public safety is one of my goals and objectives. So we both share that. And as I heard the honourable member speak, there's nothing in there that we have a difference in perspective on. The only issue that we have a perspective on is the financial situation we're in. And I will talk about the numbers, and I think the resources are there that we need. In Nova Scotia, it is a great province to raise a family, and I believe we're very fortunate to live in a province that is safe and secure. I know that it to be true, and that as someone who has patrolled the streets of Nova Scotia, and I was involved in the very project and the initiation, and I appreciated the work that the honourable member did as Attorney General in providing support for Pictou County for an issue and problem we had, and dealing with frontline issues. And so I acknowledge that work and very pleased. Mr. Speaker, I'm happy to report that the latest studies show that we have an increase of police officers in Nova Scotia. Per capita number that we have is 199 per 100 people. There's over almost 200 officers per 100,000, and this exceeds our goal of being above the national average. The national average is at 197 per 100,000. Mr. Speaker, I am proud to say Nova Scotia's rate of officers per capita has increased by 18% since 1999, and that doesn't go unnoticed, the good work that the honourable member did in making that become a reality. In 2007, the government launched the Boots in the Street. After 2 years, the commitment was fulfilled to ensure that all 55 municipalities receive at least one new officer. So his point that he made that an officer needs community, that's been achieved, and that's there. We have received a great deal of support and gratitude from provincial police agencies for the additional policing support. And we have also seen good positive results from that, as he outlined and articulated. In 2005, reports from the Canadian Centre for Justice Statistics rated Nova Scotia as the second most violent province. From 2007 to 2008, crime in Nova Scotia decreased overall by 7%, and the severity of crime was down by 9%. This is the fourth consecutive year in which we have seen a decrease, and it's the second largest decline among the provinces. Nova Scotia is also lower than the national average on crime severity, although this past month here in the city of Halifax, with 11 shootings, raises a concern, but we're working on that. We're working in partnership with the municipal police department, with the provincial police, and with the federal police, and with the mayor and council of the HRM area to address that issue. And we've had a meeting yesterday, and it happened to fall in line with this issue, but it was a scheduled meeting that we put together. We still have a long way to go, and there are commitments to finding ways to further reduce crime rates in Nova Scotia. We want to continue the downward trend. However, we need to make sure that our resources are placed in the most cost-effective ways and with the most positive impact on our province's public safety. We are looking at all potential avenues for crime prevention and reduction. I want to make a statement that we don't need our police officers working harder, we need them working smarter. We have got smart, talented, bright police officers that are highly skilled. And adding another 100 police officers on the street won't solve our problems. Investing in crime prevention, investing in the communities, identifying root causes, and ensuring that the police officers have the tools and that they're strategically focused. We are increasing our concentration on youth and communities at risk. We are focusing on the prolific offenders. improved offender integration. We are addressing the root causes of crime and developing a coordinated response to domestic violence. Domestic violence is a huge issue, and we need to do a lot more there, and we are going to do a lot more in that area. Outside of the organized crime, other types of crime and social injustice in our community contribute greatly. So we need to address not just officers on the street, but the whole system. We need a holistic approach. Our government has also given full support to the current 183 officers' position under the Boots in the Streets program. That's committed. And I had to fight hard as well to keep them there, especially in this tough economic times that we're faced with. As any responsible government, we are conducting a review of the program to ensure provincial priorities will be addressed. And I don't want anyone to read in that we're taking away or dismantling the system. We're just looking at how we're spending the dollars and how the resources are being applied and having a good collaboration with all stakeholders. We're also investing in the front end to prevent crime before it starts. It is necessary for all communities, police, and levels of government to get involved in addressing the root causes of crime in Nova Scotia. I was asked a question today by the media, what are you going to do about the shootings, and am I upset and alarmed? Of course I'm upset and alarmed whenever there's violence in the society or in the community. But one of the underlying problems that we're faced with on the issue of crime in our community is the fact that some of the victims aren't coming forward and taking responsibility and giving the police the necessary information and to go on. Also, so many members in the community that have information are not coming forward. They need to come forward. And the police can only police those that wish to be policed. And on security of a community, everybody has an investment in that and a responsibility. We need to do more in crime prevention, and we have taken great steps in that. In February of this year, 15 organizations involved in community recreational activities each received $12,000 from the province's Lighthouse programs. The Lighthouse programs helps community groups provide recreational, educational, cultural, and life skills program for Nova Scotia youth. That's $180,000 that went directly to addressing the root causes of crime. This is a program that will continue, that will be continued this year. And in fact, Mr. Speaker, I'll be in Sydney, Whitney Pier tomorrow to give a presentation and to talk about a launch of our program for next year. None of us want to see our youth get involved in crime, so we are positively supporting after-school programs like the Whitney Pier Youth Club that help the youth stay focused on positive activities. As a former police officer, I met many young people that were at risk, and I tried from a personal level to convince them or to guide them or to provide them opportunities to go in a different direction. I committed a lifetime to them. These grants will help continue the grants will help continue to go to organizations that have a track record with helping divert youth from criminal activities or the potential to be involved in crime. Mr. Speaker, we need a multifaceted approach to dealing with the criminal element and where youth are at risk. Police officers on the street is an important part of crime prevention and reduction. Our continued support and funding of the 183 positions is a demonstration of our commitment. However, we can't put all our eggs in one basket and all our resources and tools in one direction. We want to be diversified. We want, as a government, to be able to support police and look at new and creative ways in which we can deal with crime. If we stay with the mentality, put more police officers on the street, we're not going to get there. And if we had another 50 officers on the street today, I doubt that would have made a difference in the shootings. What will make a difference in the shootings is that we look at policing and crime prevention in a more creative manner, that we have a very clear strategic focus, and that the resources are there, that the management within policing know that this Department of Justice and this government supports them and are there to look at new ways to work with the community. We are actively engaged in that manner, and I am committed 100% in addressing the social issues, the criminal issues within our community. So on the issue of boots in the street, and I want to make sure each and every police officer out there knows that I'm committed to them. I know that they go to work each day and put their uniforms on or go out in a plainclothes capacity, which I had the pleasure to work in both, and they put their life on the line. And I know that the good member across the street put his life on the line, and I respect and value that. Thank you.
Thank you. The honourable member for Richmond.
Thank you, Speaker. It's a pleasure as Justice Critic for the Liberal Caucus to be able to join in this debate. In fact, I believe, Mr. Speaker, it's my first late debate since the last election, so it's been a bit of time in coming, but I'm certainly pleased to be able to speak on an issue which I've spoken on so many times previously as Justice Critic. And Speaker, the program that was started by the previous government was meant to address the fact that many of our communities needed extra support to assist in crime prevention. And with this additional funding, it's certainly the higher populated areas receive more officers. But in Richmond County, for example, which is one of the smaller areas, population of less than 10,000 now, it meant one additional officer. And that might not sound like much to the Minister of Justice or to others, but it meant a lot, I know, for the police officers in our county, and certainly meant a lot for the sergeant, who all of a sudden was able to have a new officer to deal with some of the areas that traditionally they didn't have the manpower to be able to specifically deal with. So I know he certainly spoke very favorably regarding that. And certainly, Speaker, I want to say what a pleasure it has been to work with Sergeant Rick Beaton in Richmond County. And what I've noted very interestingly is that since he's become sergeant, he's undertaken a very aggressive media campaign, in that any time that someone is charged in Richmond County, a media release is sent out. And I've been added on that release along with many others, and it's amazing how it brings a level of awareness of just how much work the police are doing. And it also serves as a reminder to people, especially when they're doing some of their roadside checks for drinking and driving, and pointing out that they've made some arrests in that regard. It sends a message out to everyone in the community. Often we take for granted the work that they're doing, but that's certainly the more aggressive approach with making people aware of the work that the police in Richmond County are doing, I do believe is paying off. Mr. Speaker, if we were to say that crime is not an issue here in Nova Scotia, I don't think anyone would believe us. Right now, all week, we've been seeing front page stories talking about shootings. You know, and again today, it seems there's even another one today. So to hear the Minister of Justice say more police officers is not the answer, I'm certainly curious as to how many more shootings are going to take place before what he talks about long-term solutions are going to kick in. As nobody questions any proposals there are to do more education, more sensibility or sensitivity towards the issues of crime prevention, but the question is, what do we do to make Nova Scotia a safe place today? You know, more and more, and I know my colleague from Clare mentioned it, and I even hear it from home where people are saying, yeah, I'm not going to Halifax, I'm going to get shot if I go to Halifax. Because it's now to the point there, people believe that there's just random shootings taking place in the streets of Halifax. Now, those who follow the stories a bit closer will know it's certainly much more isolated than that, but that is what it's creating. And the question is, how much longer before that message gets out outside of Nova Scotia, where people in PEI or New Brunswick or other areas that regularly come to our province start having that same fear, that Halifax is not a safe place to visit, that downtown Halifax is dangerous, that areas around Peninsula Halifax are dangerous. That's something that's going to have very negative connotations for our province. And Mr. Speaker, I did hear the Minister talk about the Lighthouse program, and I know that that program has been able to assist various organizations. I believe that Chapel Island First Nation is one of the recipients of some of that funding. And that is all good. The problem with the Lighthouse program is that these organizations will do the best they can with the monies that are provided. But the question always has to be, what happens when the funding runs out? And we've seen this in the past, Mr. Speaker, and I'm sure you will be aware yourself, where the federal government a number of years ago came in with all this funding and all these great programs were put in place. But after a year, the funding was gone. The employees that were put there, the coordinators, everything else, there was nothing left. And the communities on their own were certainly not in a financial position to be able to pay people's salaries to undertake, many of them were after-school programs. So the concept is great. And the concept of Lighthouse is great. But the minister needs to realize that after next year, these groups are going to come back and say, now what? And I'm sure that the minister naturally will be saying to himself, well, I need to spread around the funding to different organizations. I can't keep funding the same ones. There's only so much money. And that's natural. That's not a criticism, but that's reality. I'm sure the minister will want to share it around amongst different groups throughout the province. But for those who are approved, that'll be the question. What do we do now? And that's the unfortunate thing, because through the Lighthouse program, they will create programs that will be very valuable programs. And just when they're about to have the impact that we want them to have, the funding will run out. And it's what do we do next? So there needs to be, if the minister is serious about wanting to do education and wanting to do long-term planning, there needs to be funding to back that up. You can't just go do a photo op, present a check, and then say this is going to be a success. It will be short-term, but it won't be long-term. And what we've been waiting to hear from this government, because I know when they were in opposition, they agreed with me in saying that we need to have a better system to work with at-youth risk in this province. We need to have a sustainable go-forward plan, not just a one-year program, but something that we can work with going forward. The problem is, what we're seeing with this Lighthouse program, like so many other programs, is they're short-term fixes. And so the challenge will continue. And I would urge the minister, as he goes forward, to try to work on a plan that we can sit here, whether it's a 3-year plan, a 5-year plan, or a 10-year plan, where we can be able to work with at-youth risk throughout the province, work with these many valuable organizations that are trying to address these issues, by making sure that it's not just going to be a one-year funding, and then it's over. We've been through that. The federal government tried it. It had limited success because of the fact when the money ran out, it was all over. And the fear is that we're going down that same road here. And I'm sure the organizations are very appreciative of the monies the minister has made available to them. But when the funding runs out, they're right back to square one. And that is the sad thing, is that while these people should be focusing on working with our youth, they spend a great deal of their time trying to figure out where's the funding going to come for next. And it's almost similar to economic development groups in our communities. 80% of their time is spent looking for where their funding is going to be next, rather than be focused 80% on doing the things that they want to do, which is grow the economies of their communities. So that's the same issue that that is created here in the announcement. And what's a bit frustrating in having this debate now is we haven't had the chance to do the estimates of the Minister of Justice, to be able to ask the specific questions as to, has there been any cuts to the Department of Justice budget? My understanding is this Boots on the Street program is frozen. That funding for that is frozen, that he's not going to move forward with the next phase and the hiring of more officers. My question is, what else is in the Department of Justice? Are there going to be closures of courthouses, for example? Is that going to take place? Are we going to see reductions of some of the programs that are already in the Department of Justice? For example, the ankle bracelet program that was meant to assist people, probation officers and law enforcement officers, by having these bracelets on people, for the most part, who were given house arrest. So rather than have our law enforcement officials having to chase people to see if they're home or not, these ankle bracelets were a way of having a monitoring system in place, which means that people were actually serving the sentence that they were given and saving precious resources from law enforcement. So those are some of the questions that I have as to whether those are cuts that either have been made or are being proposed as part of this budget. And we'll certainly have the opportunity to ask many more questions, specifically the new correctional facility that's being proposed, what that facility will look like, what planning has taken place to make sure that that is going to meet the needs, because we certainly don't want to see ourselves back in a situation in the previous government where we didn't have the capacity to house inmates, that we were sending them all around the province because there wasn't the capacity. So hopefully the minister will be able to reassure us that they have done the planning to ensure that will not be the case with the new facility. Mr. Speaker, again, more police officers, I believe, has paid off dividends. And until we can see that at the time where Nova Scotia once again is the safe place that we all want it to be for ourselves, for our parents, for our children, for our families, until that happens, we have a lot more work to do, and I certainly hope that the Minister will not exhaust all avenues to addressing the issue of crime in this province. Thank you, Mr. Speaker.
Thank you. Well, I would like to thank all members that took part in tonight's excellent debate, and the time allotted now for late debate has expired. We will now take a short pause as we will continue into the Committee on Supply and bring forward the Office of Health Promotion and Protection.
Order, please. The Committee on Supply will now be called to order. Resolution E12 for the Department of Health Promotion and Protection. I will invite the Minister to introduce her staff to the members of the committee and invite her to make some opening comments if she so wishes. The Honourable Minister.
Thank you very much, Mr. Chair. Mr. Chair, I'm very pleased to be here tonight to discuss the 2010-11 budget for Nova Scotia's Department of Health Promotion and Protection, also fondly known as HPP. I'm joined here this evening by Deputy Minister Duff Montgomery, who would be known to everyone, I would think, and as well I'm joined by Tanga Roach, the department's capable finance manager, so I welcome both of them. I will be pleased to answer your questions about our budget, but first I'd like to take some time to talk about all the good work being done at HPP, as well as to celebrate some of our accomplishments to date and to highlight what you can expect from us in the coming months. When talking about HPP, you will hear me say often that we are working to make life healthier and better for families in every region of this province. I welcome the opportunity to elaborate on this very important message from my government so you can understand its relevance and importance for you and your constituents, and in fact for all Nova Scotians. The last time I appeared before you in estimates, the province was in the midst of a pandemic. The second wave of H1N1 had hit, and we were working hard to get the people most at risk vaccinated, and provide care for those who were ill. Public health and healthcare professionals and volunteers worked tirelessly to operationalize the largest immunization campaign this province and this country has ever seen. They immunized hundreds of thousands of Nova Scotians, cared for those who were sick, and educated all Nova Scotians about how to protect themselves and their families. Staff throughout HPP, the Department of Health, the District Health Authorities, and the IWK were pulled from their regular duties to invest all their energies into protecting the health and the well-being of Nova Scotians. They took care of one another under extenuating circumstances. They met each and every task with a remarkable level of determination, commitment, and passion. The H1N1 pandemic gave us the chance to demonstrate the strength of our public health and healthcare system and professionals. I was particularly impressed with the province's Chief Public Health Officer, Dr. Strang, and his teams. Time and time again, they demonstrated their solid commitment to the people of this province. We were also very fortunate to have the government's support during the response work. All along the way, we had the ability and the approval to do what we needed to do to protect Nova Scotians. That was always our #1 priority. And as a result, we distributed enough vaccine to immunize 65% of our population and inform and educate Nova Scotians about how they could protect themselves and their families. In addition, we had the capability to operationalize a massive response across the health system, a response that involves securing human resources, equipment, vaccine, and facilities to house flu assessment centers, vaccine clinics, and much more. The priority now is to evaluate our successes and to identify areas of improvement. To that end, HPP has been involved in a comprehensive lessons learned exercise. It covers everything from logistics, communications, finance, and federal, provincial, territorial work to the vaccine program and surveillance. The various departmental and provincial working groups and committees organized as a result of H1N1 have been meeting to identify what worked well, areas for improvement, and recommendations for next steps. The goal is to make any and all necessary changes to help us do an even better job of responding to the next major public health event. Many staff have also been involved in the lessons learned exercised at the federal, provincial, and territorial level. At the same time, we continue to respond to the findings of the Auditor General's report on pandemic preparedness. As we said at the time of the AG's report release, the report is about our pandemic plan. It was not about how we managed the outbreak. And as I've said before, We support what the Auditor General has said about the plan, and we appreciate the guidance and direction as to how we can improve our efforts. We are in overall agreement with the Auditor General's recommendations, and in many instances, the report validates what both HPP and the Department of Health had already identified as areas for improvement. We have already incorporated many of the Auditor General's recommendations in preparation for the H1N1 second wave. Mr. Chair, I am very proud to be the Minister of Health Promotion and Protection. That couldn't have been more true than during the height of H1N1. All too often, much of our good work, particularly in the area of health protection, goes unnoticed. Our response to the H1N1 pandemic is just one example of our success in our efforts to protect Nova Scotians. Our provincial communicable disease and immunization programs are designed to prevent communicable disease outbreaks. We're working with our partners to inform people about how to protect themselves and their families from food and waterborne diseases such as Salmonella and E. coli. Today's vaccines are safe and effective in protecting people of all age groups from a wide variety of illnesses like the measles, chickenpox, and meningitis. We're also working to control insect and animal-related diseases like West Nile and Lyme disease. Sexually transmitted diseases continue to be among the most common transmittable diseases, and the work we do helps reduce the numbers. Environmental health also involves protection measures as well as prevention and promotion. Our interactions with the environment are complex and have the potential to negatively affect our health, whether through the water we drink, the food we consume, or the air we breathe. Environmental health protection professionals work hard to protect the public from hazards in our environment. Mr. Chair, in Nova Scotia, environmental health protection measures for water, air, and food are shared between the Departments of Agriculture, Environment, and Health Promotion and Protection. In order to strengthen this partnership, there is a joint environmental health protection committee to address the gaps and identify areas of mutual interest and collaboration among the member departments, and HPP chairs this committee. In March 2009, an important initiative was started on behalf of this committee to move toward a renewal of the environmental health system. The purpose of this renewal initiative is to identify a shared vision and direction for environmental health services in Nova Scotia, while looking at the strengths and areas for improvement in our system. Through this work, which is being led by HPP, we are moving toward a more comprehensive and collaborative approach to protecting the public from existing threats within our environment and also from new and emerging issues as they arise. Mr. Chair, our work in communicable disease prevention and control and environmental health are indeed helping more Nova Scotians to be healthier and safer. It's a good example of how we are making life healthier and better for families in every region of our province. Mr. Chair, the Department of Health Promotion and Protection is leading the development and implementation of an integrated and strengthened public health system. For the last few months, staff have been consulting with our partners, community members, and many others to talk about public health renewal. Our goal is to see how we can make public health better in this province and how we can become more relevant to communities. Mr. Chair, we're looking to evolve our work in public health. Hundreds of people have been consulted so far. The discussions have been honest, passionate, and informative. The findings will be critical to our overall public health renewal efforts and our quest to better serve the needs of our population. In addition to our work in public health renewal, we are currently strengthening our ability to protect Nova Scotians by building capacity within the department, capacity that will bring further expertise and support to public health. As an example, we are moving along in our recruitment of epidemiologists and medical officers of health. The need for these qualified professionals became very apparent during the H1N1 pandemic, and I hope to have an update on our success in those recruitments very soon. Mr. Chair, the department is also responsible for monitoring our collective health status and working across government, across sectors, and with communities to create policies and environments that protect and promote the health of all Nova Scotians. We strive toward 4 strategic outcomes. 1, improved health outcomes for children and youth. 2, more Nova Scotians take an active role in promoting and protecting the health of individuals, families, and communities. 3, safer citizens, populations, and communities. And 4, reduced health disparities. HPP provides leadership in the community and within government in addressing issues from a determinants of health perspective, looking at how things like income, education level, and where people live impact their health. We also work to help influence policy decisions in other departments and across sectors. Suffice to say, it's a very busy department. Responding to the health needs of children and youth will be one of our key priorities going forward in 2010 and 2011. We will make the healthy choice the easy choice for families. We are going to tackle childhood obesity by focusing on the twin epidemics of unhealthy eating and physical inactivity. We will continue to tackle the issue of youth tobacco use and begin to advance a comprehensive approach to changing our culture of alcohol use. We are also going to support the healthy development of our children from the first day of life. Mr. Chair, we're striving for a future where children and youth in Nova Scotia will be tobacco, alcohol, and injury-free. They will be active. They will eat healthy food. They will have better overall health and every opportunity for a successful, healthy future. All of this will contribute to the future prosperity and sustainability of our province. Again, all examples of how we are working to make life healthier and better for families in every region of our province. Mr. Chair, let me first set the context for you. Our research and the research of some of our key partners says the following. In 2001, 49% of Nova Scotians between the ages of 12 to 19 years reported having a chronic condition. And that's from the Chronic Conditions in Nova Scotia 2004 report. In grade 11, 9.7% of boys and less than 1% of girls were active enough to achieve the moderate physical activity recommendation. That's from the PACE 2005 report. Students in a survey sample consumed on average about a quarter, or 26%, of their total energy intake from the other foods category, for example, pop, chips, and processed snacks, etc., of Canada's Food Guide to Healthy Living. That's taken from the PACE 2005 report. Almost 8% of Nova Scotian households with children 18 years and under reported moderate to severe food insecurity, and that's from a CCHS Cycle 2.2 Nutrition 2004 report. And our 2007 Atlantic Student Drug Use Survey showed over a 30 daytime period, 5% of grade 7 students in Nova Scotia, grade 7 students in Nova Scotia, were drunk at least once, and 46% of grade 12 students, 46% of grade 12 students were drunk at least once. And that source is the Atlantic Student Drug Survey 2007. So, Mr. Chair, health care as it exists now in our province is not sustainable. Health care spending has been rising faster than provincial revenues, and we're living beyond our means. Health care costs have been allowed to increase faster than our economy is growing. And as I said during my opening remarks for the Department of Health estimates debate, health spending has doubled in the past decade. Nova Scotians spent $1.8 billion on health care in 2001, and today our budget is $3.6 billion. This is an unsustainable path, and this government will bring these costs under control in order to ensure reliable, publicly funded health care for the years ahead. This government will manage health care spending better to ensure a strong public health care system for the future. Addressing the health challenges facing our population, therefore, is key. Starting with the early years is the most effective approach to turning things around. So now that I've depressed everyone thoroughly, we'll have a little good news. Now it's time for the good news. Mr. Chair, we're not alone in our quest. You will often hear by many of the HPP staff, in all we do nothing alone. The Department of Health Promotion and Protection works very closely with many different partners from government departments and agencies to not-for-profit organizations, schools, municipalities, volunteer groups, and many others. We respect and value the role that all of these groups and organizations have in creating the environment that makes the healthier choice the easier choice for Nova Scotian families. The opportunity for government is to provide leadership in this collaborative approach. And this government will lead the way in making Nova Scotian families healthier and safer with a focus on children and on youth. We will continue to invest in the programs and services we know are making life better for Nova Scotian families and improving the health and well-being of our children. The future of our province rests on the health of our next generation. So, Mr. Chair, HPP is joining its partners to do its part to champion the health and the well-being of our children and youth. We need only to look to the success this province has had with the 2001 tobacco control strategy to realize the benefits of keeping healthy public policy at the forefront, supported by government departments working together to achieve a common goal. Our youth smoking rates went from worst to first in 6 years. And if we take the same approach with physical activity and healthy eating, we will realize the same successes. Nova Scotians are ready for government to take a stand to support families in their efforts to raise healthy children. They need more help and more support to improve the future of their children. We also know by focusing on our children and youth, we will influence their parents and grandparents to make healthier choices as well, just as we saw with tobacco and with recycling. I suspect that at this point you're likely wondering how we plan to tackle such an enormous challenge. Well, Mr. Speaker, we will develop and launch a comprehensive strategy to fight childhood obesity and unhealthy weights in our children and youth. It will require skillful development and deployment of a full range of policy levers, all aimed at making the healthy choice the easy choice. We've just started work on the strategy and plan to share it widely with our partners and others for comments. The strategy will have two major thrusts: healthy eating and physical activity. And I look forward to keeping all of you up to date on our work and look forward to your support. We have every confidence that in working with our partners, we will be successful in our work to reduce childhood obesity in this province. The strategy will build on much of the work already underway. For example, we already have in place an Active Kids, Healthy Kids strategy. This strategy being actioned collaboratively with key stakeholders. We will examine ways to ensure existing programs continue to be effective and produce solid results while examining new and innovative ways to get our children and youth more active. We will work with our partners to explore our communities and our transportation systems so it is easier for our citizens to be active in their daily lives. This is also key to environmental sustainability. We'll also continue our work at the community level. A great example is the Municipal Physical Activity Leadership Program. HPP and municipalities work together to implement local plans that are tailored to the needs of a certain community. The goal is to increase participation in physical activity.
pardon me, the Honourable the Minister.
Oh, I did that. I'm sorry. I think I hit the button. The goal is to increase participation in physical activity. To date, 27 municipalities have come on board, with 5 more in the upcoming year. In addition, we will continue to meet our commitments under the Be Fit program. Announced in 2006 as a $68 million program, Be Fit was introduced as a 10-year initiative to fund major sport and recreation infrastructure. Although all Be Fit dollars have been committed, it does represent a significant investment that has been made in sport and recreational facilities across this province. People will benefit from this for many years to come. And while we recognize that there are more worthwhile projects, the fact is that money intended to last 10 years was committed in 4. That is not sustainable or responsible, Mr. Chair, and we must realistically face our challenging financial realities and live within our means. Community groups and municipalities will continue to benefit from another program at HPP, the Regional Facility Development Grants Program. Earlier, I mentioned that we share the responsibility of a healthier Nova Scotia with many partners. Before I move into our healthy eating initiatives, I want to give you an example of some of the great work being done by one of the province's provincial school boards. The Annapolis Valley After School Program knows firsthand that providing physical activity to students outside of school hours will help to improve the health of students, but also set the stage for healthy living into the future. A cost-shared program between the Department of Health Promotion and Protection, the Annapolis Valley Regional School Board, and the municipality covers the cost of a program leader. At a minimum contribution of $500 per partner, the benefits of the program in the lives of these students outweighs any cost associated with hiring the leader. Mr. Chair, the group leaders come from all walks of life. Some are physical education teachers, others are educational assistants. University and high school students also teach programs, along with parents and classroom teachers. Involvement in this after-school program is a true community effort. And an after-school program allows schools to have flexibility with their programs to best meet the direct needs of their students. With most programs running 2 to 3 days per week, participants are selected with the help of principals and teachers to ensure that students who are inactive or normally do not have access to sport outside the school have an opportunity to increase their physical activity levels. From yoga to kickboxing, ballroom dancing to step classes, students have the chance to learn a new activity while becoming fit. As many of these students begin to get involved, they begin to notice changes in their body shape. They look good, they feel good, and this is a natural outcome of physical literacy, which the program hopes to instill as a lifelong activity. Going one step further, Mr. Chair, the Valley School Board partnered with Acadia University to offer some accessible programs for children with disabilities. This partnership also provides children without disabilities the opportunity to experience Paralympic sports. The success of the program means it's expanding. In 2009-2010, the program expanded into 37 schools with an expressed interest which sees approximately 1,900 students every week. We are very proud of our involvement in this program and the real difference it is making in the lives of children and families in this region. Mr. Chair, under our healthy eating strategy, an excellent start has been made with the introduction of the first school food and nutrition policy in Canada. This means that every child attending public school has healthy, nutritious food and beverage options. We're now turning our attention to other publicly funded settings like licensed childcare facilities and healthcare organizations. We will work to make nutritious food the norm rather than the exception. We know that a healthy diet rich in vegetables and fruit means better health overall and helps to prevent many chronic diseases, including heart disease, stroke, type 2 diabetes, hypertension, cancer, and obesity. We also know that illness due to nutrition-related causes is costing our province vast and growing amounts of money every year. Under the healthy eating strategy, we are working to increase the amount of vegetables and fruits that Nova Scotians consume. As part of that, we're considering affordability and access to healthy food. And Mr. Chair, I don't know if you've seen any of the commercials, fresh, frozen, or canned, but they're quite snappy. They really do get your attention. If you've seen one, you'll remember it. Our work in schools and childcare centers is about access, ensuring people have access to healthy food where they are, home, school, and work. We know affordability is an issue. Right now, a social marketing campaign and work at the community level with partner organizations and grocery stores will educate Nova Scotians about how they can get more produce in their diets. And as I mentioned, fresh, frozen, and canned are all nutritious options that are available at a variety of price points at a variety of locations. This campaign is part of a larger effort to improve the health and well-being of individuals and families in our province. It's one of the many things we've done to support Nova Scotians to eat healthier and be more healthy overall. Yet another example of working to make life healthier and better for families in every region of our province. The social marketing campaign is an excellent example of how we work with partners like the Canadian Cancer Society and the Nova Scotia Heart and Stroke Foundation. Mr. Chair, I'd also like to highlight a recent example I was very pleased last week to learn about. The Cape Breton District Health Authority is working to make the healthy choice the easier choice for staff, patients, and the public by revisiting its healthy food policy. This summer, the district will begin work on a 3-year plan to create healthier menus for staff, visitors, and patients within their facilities. This work is part of the district's focus on healthy workplace, healthy communities, and healthy policies. It is also in keeping with the work of HPP to increase access to healthy food and beverages in schools and childcare settings. Mr. Chair, it's very impressive. Another healthy eating initiative will be our work to address regulatory options that are the responsibility of Health Canada, such as sodium, food labeling, and marketing. Ongoing support for our provincial breastfeeding program is another key piece. It's the healthiest food for babies, and it gives them the best possible nutritional start in life. In Nova Scotia, 74.8% of women start breastfeeding, but this drops to 15.8% at 6 months who are exclusively breastfeeding. Our statistics are among the lowest in the country. This needs to change. Breastfeeding has been shown to cut babies' risk of infections, breathing problems, gastrointestinal illnesses, and allergies. And it may also lower a mom's risk of breast, uterine, and ovarian cancers. Breastfeeding can decrease a child's risk of obesity and chronic disease later in life. On top of everything else, it helps moms bond with their babies. With all of the benefits to moms, babies, families, and communities, breastfeeding can have a significant impact on early childhood development and improved health outcomes, and this leads to decreased health care costs. The goal of the provincial breastfeeding policy is to promote, protect, and support breastfeeding in Nova Scotia. There are 10 directives in the policy, one of them being the development of a social marketing campaign, which is currently underway. And I'm sure many of you have seen the ads on buses and on TV and in the newspapers. Initiatives outlined in the policy that are currently being implemented include breastfeeding social marketing campaign to increase breastfeeding initiatives and duration rates, a provincial breastfeeding surveillance system, developing resources, educational training programs, strengthening community supports, breastfeeding peer support groups, workplace breastfeeding support programs, and implementation of the baby-friendly initiative in hospitals and public health services, and education at universities, colleges, and in the public school curriculum. The policy supports stakeholders to work together to build capacity at provincial, district, and community levels to support women and families, normalize breastfeeding in Nova Scotia, and improve breastfeeding initiation and duration rates in this province. All of this work in the area of healthy eating will ultimately contribute to a more healthy population by reducing rates of chronic disease and improving the quality of life for Nova Scotians. Through legislation and taxation, we've already had great success in reducing tobacco use rates. Smoking rates dropped from 30 to 20% between 2000 and 2008, and our youth smoking rates went from worst in the country to the best in the country. This year, we will introduce a renewed tobacco strategy that focuses on at-risk groups, particularly youth. There have been extensive consultations with our healthcare colleagues and community partners. We will work to make a culture of not smoking the norm and further reduce smoking rates. We will turn our attention to the tobacco industry and hold them accountable for their actions. Despite all of the advantages made in improving the lives of Nova Scotians, injury remains the leading cause of death and disability during the first 45 years of life, and it costs Nova Scotians $518 million each year. Injury especially impacts on our youth, causing more deaths than all diseases and other threats to health combined for those aged 1 to 19. It is also the leading cause of hospitalization. Injury places great stress on our emergency departments and other healthcare resources. We just finalized a renewed injury prevention strategy. It was developed collaboratively with stakeholders and creates a shared agenda for the next 3 to 5 years. While HPP leads the strategy, its success is driven by the collective efforts of many government departments, community organizations, and partners. The strategy reflects the necessity of building resilient populations and focusing on those factors which lead to poor health and a lack of safety. This approach will reduce injuries and improve all aspects of the health of Nova Scotians. To begin to address the impacts of our culture of harmful drinking, we need to examine ways based upon best evidence to help ensure our youth are in an environment where they can make informed decisions regarding the possible use, consumption of alcohol. The way we currently use alcohol in our province creates many harms and generates significant costs for government and our society. Learning from our success with the tobacco strategy, we plan to take a comprehensive policy-based approach to changing alcohol use in our province. I am pleased to advise you the second annual Alcohol Policy and Research Forum will address the issue of alcohol as a public health concern, increase knowledge of the current Nova Scotia alcohol strategy, and share knowledge regarding best practices in the field. Invitees include addiction staff from all the 9 DHAs, representatives of our key government partners, including justice, community services, health and education, as well as the police and the IWK. As an internationally recognized leader in alcohol policy, Dr. Tim Stockwell, the director of the Centre of Addictions Research in British Columbia and co-leader of BC Mental Health and Addictions Research Network, will join us and speak to the impact of evidence-based best practices on policy decisions regarding the health of our population and the overconsumption of alcohol. Through the forum, Mr. Chair, participants will have an opportunity to gain a greater understanding of the role that alcohol plays as a public health concern. Mr. Chair, there are 43 youth health centres across Nova Scotia. The centres provide health promotion services, on-site clinical services, and make referral to additional supports as needed. The centres are another excellent example of how we work together with our partners. In this instance, we work with the DHAs and the schools. In 2009, a provincial evaluation of youth health centres assessed the impact of these centres on the health of youth. The results were very positive, Mr. Chair. 86% of youth in schools with youth health centres are aware of the centres, and almost half of these students have used them. More than 3/4 of these students gave high marks, A or B, to the centres for treating them with respect and providing helpful information and support to improve their health. Today's youth deal with very challenging issues, and youth health centres provide them with programs, services, and supports to meet their needs. Mr. Chair, this brings me to the early years. We will invest in the early years to lay the foundation for lifelong health and well-being. The Enhanced Home Visiting Program is a great example of a program that helps Nova Scotia's most vulnerable families and children. Launched in 2004, at any given time there are approximately 800 active families in the program. A community home visitor supports families during the child's first 3 years of life, focusing on supporting parents, promoting healthy parent-child relationships, fostering healthy childhood development, and linking families with additional community resources. 98% of parents have told us that the program is working, that it's helped them be better parents, have more healthy family relationships, help them return to school, and get better jobs. Mr. Chair, I want to thank you for your attention while I spoke to some of HPP's many accomplishments and the exciting challenges and opportunities that lay before us. I hope you and all members have a better understanding and appreciation of why I am so confident to say that we are working to make life healthier and better for Nova Scotian families in all regions of our province. Before I close and turn it over for questions, I would be remiss if I didn't mention 3 final items that HPP is closely involved in: Canada Games, the Olympics, and United Way. Mr. Chair, in February, Nova Scotians and all Canadians were captivated by the 2010 Vancouver Olympics. Our athletes, Sidney Crosby and Sarah Conrad, performed well and made Nova Scotia proud. For us, the Olympics were about much more than just the performances by talented athletes. It was an opportunity to introduce our small but mighty province to the world. Atlantic Canada House, shared among the 4 Atlantic provinces, was named the #3 must-see pavilion at the Games. Atlantic Canada House had approximately 45,000 visitors in the 15 days of the Games, 3,000 visitors per day, Mr. Chair. Nova Scotia had 24 artists, 80 performances, and Mr. Speaker, Nova Scotia Day had 3 major Nova Scotia performers featured in a 30-minute presentation in BC Place before an audience of 25,000 people. Ashley McIsaac performed at the opening ceremonies of the Olympics and at Atlantic Canada House for both the Olympics and the Paralympics. Being present at the 2010 Vancouver Olympics was also the biggest opportunity that our province has ever had to meet leaders and influencers from around the world. The people who attended the Games will not forget that there is a progressive province on the east coast of Canada that welcomes investment, values good ideas, builds for success, and works hard to make sure that all Nova Scotians have the life they deserve. Mr. Chair, on the heels of the Olympics, we'll come to Halifax in 2011, Canada's Winter Games. In less than a year, Nova Scotia will host the Games and inspire and unify communities across Halifax and across Nova Scotia and across Canada, building pride and spirit as we come together over 18 days in February 2011 to showcase our sport and our culture. As the largest multi-sport event ever to be held in the history of our province, the Games will serve to stimulate the economy, create jobs, and increase tourism. Building on Nova Scotia's strong tradition of volunteerism, 5,000 volunteers will get involved in the Games and become ambassadors for the province. The Games will also provide many long-term benefits for the people and communities of Nova Scotia through leadership and community engagement, capital construction and upgrades, health and fitness promotion, and amateur sport development. The Games present us with a rare opportunity to do something incredibly special, something that leaves a lasting legacy for all. Finally, I'd like to thank the member from Halifax Clayton Park for her recognition of the United Way campaign. The provincial government again exceeded its United Way fundraising goal, raising more than $528,000, far exceeding the target of $475,000. This is due only to the commitment of government employees to help make a measurable difference for people in our community, and that initiative was led by this small but very mighty department. And acknowledged by the honourable member, I do want to thank her very much for that. So, Mr. Chair, with those opening remarks, I welcome an opportunity to take further questions from the members.
Thank you. The honourable member for Halifax Clayton Park.
And thank you, Mr. Chair, and I really appreciate having a copy as well of the Minister's opening remarks, because she did give us a good walk through the entire department, a lot of your priorities, and it is good to have it because I'm quite a note taker and I'm usually busy scribbling down the notes as I hear these different stats and figures mentioned. So it's very helpful. I want to thank you for that. I want to welcome Ms. Roche and certainly the Deputy Minister, Mr. Montgomery, to join us today and I know, to provide good advice to the Minister as we go forward. I'm going to give the Minister a little break and talk a bit myself, if I may, and I know that she's been on her feet an awful lot in the last few days, so maybe she'll bear with me because I have about 35 minutes and I did want to signal some of my interest in this, and I do have some questions as well, but I'd like to just kind of perhaps respond a little bit to some of the points already raised by the Minister, because there's an awful lot in that opening statement. To begin with, I'm very pleased to see the Minister, again, as she did in question period, reiterate her support for the Department of Health Promotion and Protection. I know we're in a climate of cost cutting and looking for savings, and that there will be a discussion about which departments belong where and how best to manage government. But I draw her attention again to the quote that I used in my question, which comes from, I believe, a World Health Organization study that said that when there is a separate entity or a separate department that looks at health promotion and protection, it actually keeps that on the agenda much better than when it gets added into acute care and becomes part of a big basket of all of the very big emergency needs that we have in healthcare. And so in order for us to move forward, I think that's important. And I think it's important for me to go back a little bit in time. And not long before I came here to the legislature, I was elected in 2003, but just shortly before that, the Office of Health Promotion was established. It wasn't a full-blown department at that time, but this had been a particular interest of our leader, Danny Graham, who was a member for Citadel at that time. He had pointed out that whole idea of let's try and look long-term and do the sort of, make the sort of policy and decisions that we need to make that will help our population in the long run. And I believe that he had a role to play in urging government at that time to establish the office. And initially there was very little budget. It has grown now to what I see as an $88 million budget for this year. And it's down slightly from last year, and we can talk about that a little bit. It's not down much, but there may have been some transfer to another department or to education, so we can talk about that. But an $88 million budget is sure a lot better than where we began, and it allows us to put our emphasis on a healthy population, which is what we really need. So I did want to mention that and indicate my support for a standalone Department of Health Promotion and Protection. And again, the Minister finished on a high note about the Canada Games, and I have to say, as the member for Halifax Clayton Park, we are absolutely delighted to see the $40.5 million centre. I don't know if it's changed in its budget, we might get there, but we know it as a $40.5 million centre being built right now on Lacewood Drive, creating a complex really for us on the mainland common with a beautiful community library, a high school. I know a number of people here know that area well. We have a beautiful high school that was just opened in 2002, and so really we feel that this is going to support the health and fitness of our young people that are studying so nearby. It's going to be a tremendous asset for the families in that area. And the Deputy Minister minister will remember that I have visited him. I'm not one that, I'm not a member who frequently visits ministers' offices, I have to say, and maybe based on my question the other day to the transportation minister, I should be doing it more often. But I normally don't present myself at the doors of the ministers, but I did with the previous Minister of Health Promotion and Protection, because building the right size centre for Clayton Park meant an awful lot to me, that we not look in a narrow-minded, short-sighted way and build based just on the available budget, which was what we were being told. I mean, initially in 2005, our community was presented with a plan that would have been about an $8 million replacement pool, and it would have been incredibly small and inadequate for the thousands of people who live right there in that community. So, we wanted to do whatever we could to help leverage a situation where there would be more money available. At the time, we were still looking at the Commonwealth Games, and that was a possibility that there might be an opportunity to build a centre, leveraged around that Games. And then there was also the Canada Games, which was, at that time, we were not sure where it would be hosted in Nova Scotia. But I can tell you that we are absolutely delighted that there was a delay in making that decision, so that the Canada Games was able to dovetail with the facility needs in Clayton Park. And when I speak about Clayton Park, I think it's important to mention, because it is such an urban riding, that really we're talking about a community of over 100,000, not all of whom I represent, but people who are very close to that location of where the Canada Games Centre is being built. So the legacy will be well used, and we have the population base right on the doorstep of that facility to ensure that it's going to have, I think, a very, very stable funding as it goes forward, because their people are there to use it and to support it. And I do hope as we go forward there can be help for families who can't afford fitness memberships and charges and so on, and that's something for us to discuss perhaps as we go forward. But I wanted to talk about around the BFIT and other programs, and again, it's a bit of history too, but in 2003 when I was elected, the province of Nova Scotia had only $3 million a year that they were putting into facilities, and that really meant that they were just making small contributions towards municipal projects. And we regarded recreation and sport facilities, unless they were really designed for athlete training or some sort of higher level training, we regarded them as a municipal concern. And what's really happened is construction has, the costs have just overtaken the capacity of many of, really all of our municipalities, because even HRM, which is our largest and, arguably our best off municipality, because it has the largest tax base and property base, couldn't afford to provide the facilities and the needs that would meet our needs. The members' own riding has the HRM Centre, the Needham Centre, which I know is so important to the people in that area. I know some people living in the North End, and there's talk in HRM that, oh, it's an aging centre and we can close that and build something big somewhere else. But what people need, and especially low-income people, they need to have a facility close to home. You don't want to build something big and regional far away from where those children are, because if they don't have much money in the home, they're not going to be able to afford the transportation. The parents want to have a safe place where their children can go and be physically active and be close to home. And the Needham Centre is really well located for that. And so those kind of facilities, I think we need to try, where they exist now, we need to try and protect them. And that may mean the province has to be there. And BFIT, I understand, is now just about, well, it's fully committed. We could say it's exhausted then. And, I was starting with the $3 million, which meant that when we first started talking in Clayton Park about what kind of facility could we build and where would the money come from, we weren't able to leverage really anything from the province, because we were told at most you'd get $300,000 or maybe $400,000, that would be it. And we were talking about a $20 million centre at the time. So it was immaterial almost, not to ever turn up your nose at any contribution, but it wasn't going to get us to the point of having that facility. So, we've made some strides. I have asked questions over the years of the Minister of Health Promotion, asking that they do more, and I take some pleasure and pride in feeling that I may have helped to push that envelope and get us to the point where a BFIT program was announced and there were some substantial dollars to invest. But I'm sorry to see that it is pretty well fully expended, because I don't believe that I should stop being concerned about it just because my community is now going to be very well served. I'm delighted, as I say, with the Canada Games Centre coming. But I know that the need is there, and in order order for us to keep the kids active, which the minister spoke eloquently about, we need to be able to invest even in small facilities, or we need to leverage money with school boards so that they'll open up those schools and let the existing facilities be used. Because we can't have people, you know, and again, if you get to a more rural or towns and villages, they don't have really anywhere to go and be active. And my mom has a cottage in Parsboro, so I go there in the summer, and they have, you know, they'll walk around the fire hall, around the outside, like get inside and just walk around this little square building. I'm thinking of the older women and so on that just want to get out and walk in all weather, summer and winter, if it's raining and snowing, and you know, that's just not very effective, that's all. And yet you can see the people trying to keep active. So we need to try and just help them and make it appropriately sized, but try and give every community the opportunity for good health. I mean, of that huge Canada Games Centre, I'll bet you one of the facilities that will be most valued will be the walking track. And that's not the most complex of all the components of it, but people want a safe place to walk, and older people want to avoid those injuries and falls that you referred to. They need a safe place. And I've heard of a place in Newfoundland, it's actually at Memorial University, where they have a turnstile. People don't have to belong, but they put a toonie in it and off they go on their walk. So they go through the turnstile and they use it, and they collect so much money in that turnstile, because that's exactly what people are looking for, just the chance to walk. They don't want a lot of fancy equipment. So I think that's very good. I really did want to again thank the provincial government for being a partner in that Canada Games project, and I know that we will have a lot to discuss as it goes forward. Again, as the MLA for that area, I hope that I can be involved and be of any help that is possible with the government as that comes forward. And I guess, without asking a question, I would like to just mention that I'd love a tour of the centre when it becomes time. And it looks like it's all ready to go, and I'm sure the minister will go on a tour. So perhaps we could dovetail, and I'd be happy to have her come and visit my community, because I am anxious to go into, you know, through the doors and have a look at it in person. So I know you'll have made a note of that. During my questioning today, I have really a line of questioning around alcohol. And you had a long opening statement, and I kept thinking, well, we're talking about food and fitness and a lot about youth and obesity, but I wasn't hearing anything around youth and alcohol and women and alcohol and just the damaging alcohol culture that we have in this province. And I'm sure that that is on your agenda, because you did have it there at the end of your comments. We did touch on that. And I know the minister gave us some disheartening figures during part of her opening statement. They weren't all depressing. There's certainly some great news stories. The Annapolis Valley School Board and what they're doing in the after-school program with leaders is a wonderful thing. But I wanted to give just a few facts that I think should have every member of this House, and I know we're not all paying great attention during this debate. It's not really a debate, it's budget. But I guess I'm signaling this is an area that we need to be aggressive in. I was happy to hear you say that there's an upcoming alcohol policy research forum, and that's May 7th. I'm actually registered to attend, as I hope to be there all day and participate in that. But you know, with that in mind, that's good, and it's our second annual. It's not the first, so I'm glad to see that. But here's some figures, and we've just come through, you know, practically a week of health estimates. So we've been talking about the cost to health. These come from the Nova Scotia Alcohol Indicators Report, and I'll even table this. You probably got them all, but I have them on one sheet, which is kind of nice. But here it is: 42,000 hospital days attributed to alcohol. All right, 3,100 alcohol-related hospital admissions, $78.1 million in law enforcement costs. Well, that takes us out of health, but it's still very important to us. 1 of every 4 highway deaths in the province related to alcohol. We have, you know, over 9,000 people living with fetal alcohol spectrum. And the minister herself talked about the number of young people drinking heavily. 1 out of 4 Nova Scotians reported drinking heavily in the last 30 days. 52% of Nova Scotia drinkers between 19 and 24 report drinking heavily in the last 30 days. And it goes on, including, I think, a figure that the minister used: 46% of grade 12 students report being drunk in the last 30 days. And as a mother of a 20-year-old and a 23-year-old, I can tell you there's a lot of anxiety, free for parents who have the children just under the legal age. We should still be worried when they're over the legal age because they're still drinking in an unhealthy way. Sorry. Yeah, you fall into that age group, do you? We have one member in the House who's self-identified. What can I say? But, yeah. Thanks, Matt. We'll talk later. No, you know, these figures, though, when they were presented to me, and somebody had brought this to my attention, and again, as the minister knows, I've often said some of the very best ideas that I've, you know, taken I guess, taken the reins and run with have been ideas that people bring to me. I don't just stumble across these things generally, but somebody else who's been closely related or had an issue has brought this to me. So I'm sure the minister has all of these. I'd be happy to table them. If maybe I will, I'll just table them for the record. But, you know, those figures are so startling and so worrisome. And as I said, on a personal level, parents are worried. And there was a study done by your department about youth and child alcohol consumption, where you did focus groups and, I guess, roundtables talking to people. And I had a look at that study, and what it did say were parents were upset and wringing their hands, but feel it's inevitable, feel that this is some kind of rite of passage. But I know, just speaking from my own neighborhood and anecdotally, the age of the kids that are getting seriously drunk is younger and younger. And I'm hearing of kids like in grades 7 and 8 that are being, you know, really being brought home or passed out in the parks or whatever. They're normally, you know, drinking in parks or public places. They certainly are the cause of a lot of calls to the police non-emergency number, because that's how we respond. But I wanted the minister to know that I'm very concerned about that. And so I want to talk a lot about where we're going to go on the youth drinking strategy and what we might do policy-wise to try and address this. I'm told that New Zealand is one country, and Australia too, I think, to a degree, who recognized that they had a pervasive drinking culture and they had to do something. And they looked at, I see one of the members who knows Australia giving me a nod, because they had a very macho kind of culture, which included a lot of heavy drinking, and they sat back, looked at the sort of statistics that I've given. That doesn't show the productivity loss, the wage loss, the cost to employers and so on in the economy. I was talking health really there. But when we look at it all, it's tremendously damaging to our society. And I know the minister spoke about the success we've had with tobacco and our tobacco strategy. And I believe we can do the very same thing. And you've talked about how we can change the social costs and some other issues that if we change the societal aspects of this, we will change behavior, and that will help us all. So I really do want to go to that. And what I'd seen in the New Zealand strategy was they have 5 things that they looked at, and perhaps it's similar to what we did with cigarettes. They looked at increasing alcohol prices, reducing its accessibility, reducing marketing and advertising, and increasing impaired driving countermeasures. We've done quite a bit of that here in Nova Scotia. Increasing treatment opportunities for drinkers. Those were their 5 points that they had as sort of a best practice. And I would ask that you know, we incorporate those and look at the experience in other provinces. But I really want the members of the House as well. I think we should be debating this probably in some form here in the legislature, so that this issue comes out of the sort of behind closed doors or wherever it's being silenced, and we really start to shine a spotlight on it, because I'm not a prohibitionist by any means, and I'm sure that neither is the minister or others in this House, but it's just talking about a balance. When I spoke to somebody in, I guess it was in health, I think, but they had said that our consumption is pretty much on a per capita basis fairly standard in terms of the Canadian average. We're not really above, but our pattern of drinking is binge drinking. We have much more of that, and 20% of Nova Scotians are really binge drinking and drinking in an unhealthy way. So we need to really look at that. And I would ask now, I guess I should get to a specific question, because the minister is, mind you, you needed a break, I have to say. I really did feel that, you know, that we've been putting a lot of stress on your voice lately. But I wanted to talk about women and drinking for a minute. I've signaled my concern about youth drinking. But There was also a report done on women and drinking, and women do not drink, at least at the moment, we're not consuming as much as men, although they said girls are drinking more than boys, just in general. And what I'm concerned about, and that is a comment in, I'm going to try and find it directly, in this report on drinking here, which was the Women and Alcohol in Nova Scotia, an analysis of information in the culture of alcohol use. It's June 2009. At the back, one of the recommendations, in fact, the first one, is the findings from this report and the 2008 Culture of Alcohol Use in Nova Scotia report should be communicated to key stakeholders throughout the province. And I'd like to question whether or not the Nova Scotia Liquor Commission has been very much a stakeholder in that discussion, because, and we can go to it directly, but their annual report spoke very directly of targeting women. There was a little bit of news about it in the newspaper at the time, but they said, you know, guess what, men are drinking lots, let's target women because that's our best marketing opportunity. And I'm sorry these aren't in color, but I'd like to just put in a couple of other things to table, and that's a picture of a shelf in our NSLC store selling a product called Girl. It's some sort of hard liquor that's called Girl. It's pink bottles, and it wouldn't appeal to me, so this is target marketing young women, because I don't want to buy a pink bottle called Girl, but it's obviously designed to get young drinkers and young women to buy that alcohol. There's more coolers, there are more things that taste like pop, less things that taste obnoxious. They're adding lime now to beers, and women will buy it. Women don't like beer, but women will drink lime beer. So there was another article in the paper about how nice lime beer is. Uh-oh, maybe people under 25 like lime beer as well. I'm getting that cue. But, you know, must be that hour of the night. Perhaps I should just go to 8 o'clock. But, you know, it concerns me, and yeah, what I would like is that the minister would look at that. I'm sure the minister is aware of the report, and I'm trying to find it here, but the NSLC report, there you go, it's on page 14 or 15, where they talk about their marketing, and I guess I will add it in here as well for the record, but two discernible, let's see now, we have to find where women are. It talks about how we're all segmented, but they definitely want women here. Anyway, I can't find it precisely because my copy that's highlighted isn't in front of me, but it is on page 15 where they have sort of sliced and diced the market. They give various age groups, interesting age groups and types of drinkers. They have the adventurers, they give us little names. The adventurers, the loyalists, the discoverers, the maintainers. The maintainers buy the same product and they shop occasionally and spend less on average. So they'd be ones to go after. The discoverers as well, spending less on average, buying different products across categories and shop only occasionally. Adventurers, which I would hearken to say is not a very good word to describe somebody who buys different products across categories, shops more frequently, and spends more on average. I don't know that that makes an adventurer, but when we're talking about the consumption of alcohol. But they very clearly said women are our best market, and young women at that. They're looking at younger women's consumption. And that seems to me to say we didn't communicate what you've just learned, and I know it's recent. You've only got that report on women and alcohol, you know, in 2009, but we need to communicate with the Nova Scotia Liquor Commission because you know, it's very similar to what we've got with gambling and somewhat with tobacco. Although we've changed the culture so much that we don't like to look at tobacco at all as a revenue generator. We're getting taxes from it, but we're not. You know, we know that if we increase the taxes, we just have more illegal tobacco, so we're not going that way. But with gambling and with alcohol, we really look for the revenue. I guess we call them government business enterprises. We want the revenue, and it's you know, it's kind of a dichotomy. We want to be socially responsible, but at the same time, we want to market more. And you know, the department, if there's one department in the whole government that can speak for this and try and help help us. It's the Department of Health Promotion and Protection, because that is your mandate to try and step in and bring in some policies that will not normalize and encourage the consumption of alcohol for women and young people. So I'm going to turn it over to the minister to see if she's got some stats or some figures or some costs that she can associate with this effort.
Thank you. The Honourable Minister for Health.
Thank you very much. And the honourable member has initiated the estimates debate with a really important topic without any question, and we can't really do it justice in the time that we have left. But let me start first by telling you just a little bit in a broad, general way. You know, in a recent discussion I had with Dr. Strang, I believe he said to me that the data suggests that 10% of all hospital admissions in Nova Scotia are alcohol related. You know, that is a tremendous proportion of hospital admissions. And if we could make even a small dent in that, we would be having quite an impact on our healthcare system. Not that that is the only reason why we should tackle this, but I use that as an example. The honourable member, tabled some stats, and those stats actually, I'm told, come from our own prevalence study at HPP, which we co-lead with BC. I understand it's a kind of a national initiative, and we
each do it separately, but we check with each other.
We do it separately, but we're two provinces that do this. And this has been on the department's radar for some time, the need to develop and have good public policy to start dealing with. And of course, one of the first things, or I shouldn't say first things, there's not really a first thing, but one of the tools that you need in your tool bag is some hard evidence and data that give you a good picture of what you're dealing with. And we know that we are dealing with underage drinking, for example. Underage drinking is a problem. And I think the honourable member is absolutely right. The data suggests that kids they're drinking at a younger age. And I not only see this in data that's presented to me by my department when they do these studies, but as Minister of Health, I have people who write letters. School principals have written letters to me asking if there's anything that can be done for a child who's 9 years old who has an alcohol addiction. I mean, that has to, it just rips your heart out when you read stuff like that and you think, how can this possibly, a child that's that young. I've worked for many years with children and adolescents, and I myself see the enormous change that has occurred over, a 10 or a 15, 20-year period. Binge drinking. We know binge drinking is a problem, and we know that binge drinking is a problem that cuts across age groups too, I think. It's not necessarily peculiar to young people. We know that we have to strike a balance. I look at the Nova Scotia Liquor Commission, and who have been running they've been running a kind of a social marketing campaign around responsible drinking, which I think is very much aimed at young people. And we can certainly talk more about some of the issues specifically around marketing toward young women that the member raised. But I want the member to know that the department has certain initiatives, and I know you've registered for the second forum on alcohol that's coming up in May, which I think will be a very exciting opportunity to really hear from people across quite a broad spectrum. In addition to that, I want to mention for the members that we have a road safety advisory work group or committee, and it involves a number of ministries. It involves the Minister of Justice, it involves the Minister of Transportation and Infrastructure, it involves Service Nova Scotia, as well as the Minister of Health and Health Promotion. And certainly this is an issue that is on the radar of that particular working group, and something that we will be doing some work on in the coming year, and will, you know, correspond to some of the concerns around drinking and driving and underage drinking and driving, and these issues. So there are many, many initiatives. There are many things that are going on. The staff in the department in HPP are very much on top of doing scans in terms of what are the best practices from around the developing world. I know that the member made reference to New Zealand and Australia, I guess, and their alcohol strategies. I think the UK has more recently initiated a strategy as well, because binge drinking in particular has been an area of great concern there. So these are all, we try to not reinvent the wheel, but look at what's occurring elsewhere. This is very important. I have a particular interest in terms of women and addictions. I've been interested in women and addictions since my very first summer job in the quasi-social service field, I guess. I worked at that time for what now is Health Canada on a project one summer that involved going out and doing group discussions with women using a tool that was called It's Just Your Nerves. And it was a tool that really helped women talk about alcohol and drug use as well. And when I say drug use, I mean prescription drug use, the mood-altering drugs like Valium and what have you. And, you know, at the time, we were seeing a great increase in the numbers of women who were really sort of cross-addicted. They had alcohol and prescription drug addictions with these mood-altering substances. And you know, Mr. Chair, I don't know if people recognize, but alcohol is a depressant. And it, for people, many people who think, you know, they drink, they'll feel better, they're a little down, you know, make them happy, make them forget their troubles, da-da-da. Well, alcohol as a physiological compound is actually a depressant, and it contributes to people's depression, rather than maybe for the short time you might feel a little better, but in the long term this isn't the case. So there's a lot of work we have to do, educational work and other work, I think, to address what is a serious problem, great cost to the individual, to their families, to our healthcare system, ultimately to our society, Mr. Chair.
Thank you. The honourable member for Halifax-Clayton Park. You have 30 seconds.
Well, thank you. I didn't realize we had a few more seconds for me, but I'm glad to hear the minister's interest in looking at women and addictions as well, and women and alcohol consumption. I had some other figures I was going to go to as well on that, which talk about some of the other societal problems around women drinking and the incidence of violence against women, sexual assaults and so on, and they are certainly well documented as well. And I'm hoping that we'll learn a lot from the other studies that have been done and the other changes that have been adopted in other countries, because I think that we need to tackle this. I would say to the minister, and we can talk about it in more detail, but I think some of this is low-hanging fruit, which is, you know, an area where we could start to make some changes and make people healthier and see some financial results right away. Thank you.
Thank you. The time has now allotted for debate in Committee on Supply, and the time has expired. I will now go and recognize the Government House Leader.
Why, thank you, Mr. Chair. Mr. Chair, would you please ask committee to rise and report progress?
Is it agreed? Motion is carried. Yeah, hands are